Good afternoon. My name is Sarah Navarro and I currently work for Home Healthcare. I've worked here for 2.5 years and I'm here to speak with you a little bit about strokes. Most of our patients are stroke survivors, so I just want to give you a little bit of continuing education and information as to what it takes to assess a possible stroke happening in one of your clients. As a fellow home healthcare aide, we are often left to our own instincts, senses, and knowledge to recognize when something is not right with our clients. When you're in home healthcare, you're not constantly surrounded by other nurses, doctors, or healthcare professionals to come to your aid when there's an emergent situation going on. So you need to use your own instincts and knowledge that you've garnered from school, personal or work experience, or continuing education experience to help assess the situation and get the best care possible provided to your client. With that, we must remember that strokes do not discriminate when it comes to age, gender, race, health, or wellness. They can virtually strike at any time or any place. So essentially, everyone is at risk for developing a stroke. That's not to say that there aren't some people that are more at risk, because there are. People that have had previous strokes are more at risk for developing a new stroke. People that are smokers, heavy drinkers, that have hypertension, high cholesterol, or diabetes, or other health issues going on are more at a risk for developing strokes. What we can do for them is to encourage them to lead healthier lifestyles. In home health care, you can't force someone to do anything, or in healthcare in general, you can't force someone to do anything, but it's our job as healthcare workers to educate people on healthier options or habits. So, with that being said, the last thing I would like to remind you about is the FAST acronym and mnemonic that we always use. FAST is a term that is a quick and easy tool that we use in the healthcare setting to remember the sudden signs and symptoms of a stroke. The first letter, F, stands for face. When you're looking at the person's face, you want to look for face drooping, and this can be drooping of the mouth or drooping of the eyelids. It's pretty obvious when you see it. That's pretty if you see that going on, you might as well just want to call 911 right away. But there's also some other signs to look at. A is for arm weakness. If you don't see as much face drooping, you can look at their arm weakness. Ask them to hold their arms out in front of you, like so. If one of their arm begins to droop or they're not able to even lift the arm, that's a possible indication of a stroke as well. The S stands for slurred speech. If they are unable to talk without slurring their words, or they're not even able to talk really at all, it's possible they're having a stroke. And T, the last letter, stands for time. Time is of the essence because it is a medical emergency. It is very important that you call 911 right away if you suspect anyone of having a stroke, because if you don't get them help right away, a stroke can cause severe damage to a person, even death. A lot of people every year die from strokes or are severely disabled from strokes. So it's better to be safe than sorry, and I'm sure that more often than not, if you see any of these symptoms, it probably is a stroke. So if you have any questions or insight or input, you can contact me at my email. Thank you.